Why are STDs on the rise in older people? And in particular, why are older women particularly susceptible to getting STDs? We're talking about sexually transmitted infections or sexually transmitted diseases, guys. Yes, STDs are on the rise in older people, and yes, women are more susceptible, older women. I'm going to give you the answer to both of those. I'm Dr. Jen Caudle. It's good to see you guys. This is a really important topic. Let's start talking about in general about why STDs are on the rise in older people. First of all, write in the comments if you knew this was happening. Write if this is a surprise, if it's not a surprise. Write about your own particular situation if you want. Oftentimes what you write helps other people. There are a few reasons why STDs are on the rise in older people. And yes, older people have sex, okay? I know a lot of people out there sometimes think that as we get older, people don't have sex. That couldn't be further from the truth, and thank goodness for that, right? Sex is a natural and normal part of life. So let's just level set with that there. First reason why STDs, in no particular order, why STDs have increased in older people is number one, medications like Viagra now exist. What do I mean by that? What I mean is that we have more ways to allow people as we get older to have sex, more ways that maybe we didn't have before, whether it's erectile dysfunction or things like that, or even vaginal dryness, right? We have medications like Viagra and other medications, Cialis. We have lubricants and moisturizers for vaginas to help. Maybe and definitely back in the day, a while ago, we didn't necessarily have all these tools to allow people to physically have sexual intercourse, sexual encounters. So one of the reasons why we're seeing STDs is that older people are able to have sex because of some of the advents of technology, medications, et cetera, that we have, which, by the way, that part is a good thing. Another reason that many experts cite, by the way, and the statistic that older people, STDs have increased in older adults comes from the CDC. The second reason, though, is the divorce rate has increased. There are more people as they get older that are now divorced, maybe have been in a monogamous marriage relationship for a long time and suddenly are not, and now are in the dating field. They are looking for love, and why not? But this is also something that has likely contributed to the increase in STDs that we are seeing in older adults. The divorce rate has increased. Also, a decrease in sex education. This is something that has been cited by a number of studies, and researchers, et cetera, have said that perhaps as we get older, we don't have the same level of sex education that perhaps younger people have. I want to know from you guys if you feel this way, if you don't. Some researchers and research studies have cited that there are many older adults who simply just may not be aware of all the different STDs or the different ways that STDs are transmitted, may not be sort of up on sex education again, like perhaps younger people are. So that's also something that we think may be contributing to it also. And by the way, stick around because I'm going to tell you why women, older women in particular, are susceptible. I haven't forgotten about that. We're going to get to that. The next thing is sort of related to sex education, but it's different. As we get older, and older people just may not be accustomed to thinking about things like condoms, right? If you were in a monogamous relationship for years, marriage, etc., you may not be thinking about condoms. Why? Because you may not have used them before. As folks get older, we just may not be accustomed to thinking about STD prevention, STD protection, the things that one needs to do when you're out on the dating scene, etc. So that is something that may contribute to the increase in STDs as we get older. Also, we have to remember that our immune system does decrease, it does decline. Our immune system does not work as well. This is sort of just a fact. It applies to both men and women. By the way, all of these things that I'm mentioning right now apply to men and women. I'm talking about older people, both genders, okay? But we also know that our immune system does not work as well as we get older. This applies to everything, the risk for getting colds, infections, etc. It's one of the reasons why as we get older, your doctor starts recommending things like the pneumonia vaccine, the shingles vaccine, all these different vaccines that either we need boosted or you need sort of new vaccines because our immune system does not work as well. That's why we have the high dose flu shot, right? And that's for people who are over a certain age, it's because our immune systems do not work as well as we get older. So we want to boost the immune system. Well, that decreased efficacy of our immune system applies to STDs, right? So if our immune system does not work as well, may not be able to fight off things as well, may be contributing to the increase in STDs that we are seeing in older individuals. Also, I would say too that many STDs don't have symptoms. Now, I think this one could apply to really any age, but sometimes it's hard to suspect, get treated, get tested for an STD if you don't see symptoms, right? And honestly, there are many STDs that don't have symptoms. Or maybe as we get older, we have symptoms of STDs, but your doctor, me or others, we may attribute it to something else. Maybe your doctor is not thinking about STDs. And this is a little bit of a call to action to my colleagues. As a family doctor, a large part of my population is over the age of 65. But as medical professionals, we need to be counseling and educating our patients about safe sex, and also keeping that in the differential when our patients, you all, come to talk to us about things. It may not be dementia. Maybe it's neurosyphilis. I've seen a case of it, right? So it does happen, okay? So those are some reasons that we think that STDs are increasing as people get older. A few things that you can do. I'll say this before we get to why older women are particularly susceptible, but a few things that you need to do. First of all, I'm not anti-sex. Sex is a wonderful thing, and for the right people, in the right situation, in the right environment, etc. Sex is a beautiful, wonderful thing that really can promote intimacy, connection, can enhance our health, and so many different things. But no matter what age you are, I'm talking about adults, no matter what level of adulthood you are, especially older individuals, just like younger ones, if you choose to be sexually active, you need to be thoughtful about this. Kind of screen your partner. Get tested before you become sexually active. This is something I recommend to my younger patients and my older patients. Make sure that you are wearing condoms. Condoms are important. Also, make sure that you're using lubricants, especially for the ladies. I'm going to get to y'all in just a second. Make sure the lubricant works well with the condom. What I mean by that is not all lubricants are okay for condoms, meaning some lubricants can actually decrease the effectiveness of condoms. You need to talk to your doctor. You need to be very thoughtful about this. So don't just use any old thing to lubricate yourself, because it could reduce the effectiveness of condoms. Okay, keep that in mind. But yes, using lubricants, the appropriate ones, wearing condoms, getting tested, talking to your partner, screening your partners, being very thoughtful. Those are things that are very, very important. Now, let's get to women. Let's get to the ladies. Why are older women in particular more susceptible to getting STDs, STIs? It is because as we get older in age and become menopausal, vaginal dryness increases. The risk of vaginal dryness increases. Our vaginal tissues get thin. By the way, this is because of a decrease in estrogen due to menopause. Our vaginal tissues start to thin. Our vagina gets drier. We have decreased lubrication. All of these factors and more increase the risk of vaginal tears. If you have vaginal tears, that then can increase your risk of getting STDs. So keep that in mind, ladies. That is even sort of an additional risk factor that we have. Vaginal dryness, vaginal thinning, etc., increases the risk of tears, which can increase your risk of getting STDs. In addition to the things that I mentioned that apply to both genders. Guys, let me know what you think. Let me know if this is helpful. Make sure you share this with your friends and family and your other folks that are sexually active or not, because this is good information. I hope you think so too. No, I think it is. Let me know what you do in the comments. Let me know what your practice is. If you have any tips for other people, share them, please. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Y'all know that. Please, on Facebook, follow my page. Like my page. Yes, like my page. Follow my page. For those of you who send stars, I respond personally. Thank you so much. Consider joining my subscription groups. I do private lives for subscribers every Wednesday on Facebook, YouTube, Instagram. On YouTube, please subscribe to my channel. Click the little bell for updates. Go to my website, drjencaudle.com, for more information, more tips, more things, my free health newsletter, all sorts of stuff. Guys, I love you. Okay, we'll talk to you soon. Bye.